Hi friends, now this topic, it's a quick session on Whipple's disease which comes under medicine. So Whipple's disease, they tend to ask you just 3 points. What is the etiology, which is very simple, and what is the pathogenesis, like what happens in Whipple's disease, and they ask you what stain do we use in this disease, okay, to diagnose it, either stain ആണ് use ചെയ്യുന്നത്. So quickly, what is the etiology? See, again, this is an immune-mediated problem. So when a bacteria enters the body, usually normal, healthy people, what happens is the immune system kills it. But in some people, no, the immune system is defective and it won't be able to kill the bacteria. So when a person who has got defective immunity, when his body encounters a gram-positive bacteria called as Tropharema whipplei, okay, then the problems caused due to it, that is called as Whipple's disease. So etiology endana? Yeah, when the gut gets infected with a bacteria called as Tropharema whipplei, first thing. So etiology is done. Next is, what is the pathogenesis? Okay, so when this bacteria enters the body, normal person enter idala, okay, we have got our immune cells, macrophages. Yeah, so let me just draw a macrophage here. This macrophage will engulf the foreign body. Okay, this macrophage will engulf the foreign body. But in some people whose immune system is strong, they have got altered immunity. So if the macrophages are not very strong and they won't be able to kill the bacteria, this bacteria. And what happens? The bacteria will multiply inside the macrophage. Okay, so this gives macrophage a specific appearance called as Fmge. Okay, so ഇങ്ങനത്തെ macrophages-നെയാണ് നമ്മൾ Fmge macrophages എന്ന് പറയാം. Fmge means ഒരു വാക്യുലേറ്റഡ് സ്പോഞ്ച് കണ്ടിട്ടില്ലേ, കുറേ ഹോൾസ് പോലെ കാണുമല്ലോ ഒരു സ്പോഞ്ചിനകത്ത്. അതേപോലെ ഇങ്ങനത്തെ മാക്രോഫാജസിനകത്ത്, because there is piling up of bacteria inside them, it gives a Fmge appearance or a vacuolated appearance, and that is what we call as Fmge macrophages. Now remember, these macrophages, where they accumulate in the intestine itself. Okay, see this bacteria, when it enters the intestine, the immunity cells sends macrophages to kill the bacteria. The macrophages will engulf the bacteria, but it won't be able to kill it completely. The bacteria will multiply and it gives a Fmge macrophage appearance. And the bacteria, okay, it has got glycoprotein in it. So if I want to see this organism, okay, what I do is, bacteria bacteria glycoprotein, it is very rich in glycoprotein. So if I want to see glycoprotein, okay, there is a stain called as, okay, PAS stain, periodic. I think there is some problem with the net connection, that's why it's not becoming very clear. Anyways, glycoprotein stain the PAS stain which done, that is periodic acid shift stain. We take the biopsy, okay, intestinal biopsy, and we stain it with PAS stain. If this is a bacteria that is present in the intestine, you can see, I'll show you the picture, you can see Fmge macrophages. Okay, pardon me for the low clarity, there is some issue with the network here. So see guys, this is the intestine. How did you identify it? You can see the goblet cells, okay, so that's how you know, okay, this is intestine. And inside the intestine you can see the cells, and you can see these whitish areas, right? Okay, so whitish areas because in macrophages there are the bacteria is multiplying, there is debris, so you can see vacuolated appearance of the macrophages. We call it as Fmge macrophages. So that is the pathogenesis. All right, and the third thing is what guys? The stain used. I told you, if you want to see Fmge macrophages in Whipple's disease, you use PAS stain, periodic acid shift stain. All right, let's go to the question. Okay, read this question guys, very simple. Which staining technique is used to diagnose Whipple's disease? The answer is, yeah, that is PAS stain. Where is my PAS stain? PAS stain. Okay, so yeah, these are the questions they ask you in Whipple's disease. Etiology, pathogenesis. Pathogenesis and why it happens? Because the macrophage is defective, right? And the macrophages which and they have inside them what? The piled of bacteria. Like bacteria multiplies in the macrophages and they get deposited in the lamina propria of the intestine. Okay, that's why we take the intestinal biopsy and we see what? Fmge macrophages. So yes, so that's all about Whipple's disease. That's a quick bite session on this topic. Bye-bye.